Sanjay Parihar. I'm from Houston, Texas. I'm a technologist. And as we always wanted to help hospital industry by bringing professionals. So here we are with Dr. Dikha, who is working actively, who's the director of head of strategy, NGO, ATTAC. And she has worked on the Yuvraj Singh Foundation as well. So, welcome Dr. Dikha in our show.
Thank you for having me. Thank you.
Thank you very much. And Dr. Anand is also with us. So as you were working on NGO and in ATTAC, and as well as you had work in Yuvraj Singh Foundation, since we are specifically going to talk about hospital industry, but before that, we want to know about your experience. What exactly you're doing there, and what's your inspiration overall to work with NGO?
ATTAC, aimed to terminate tobacco and cancer society, started in 2014. Our founder, Dr. Sumedha Kushwaha, she was doing her public health dentistry master's, and she started it in her postgraduate. So it's very common for us dentists to, when we go to OPDs or we go to outreach camps for our public health postings, we encounter a lot of oral lesions. Now, it's not cancer, I wouldn't say it's cancer, but these oral lesions, sometimes people also don't realize it's there in their mouth. So that prevalence of, cancer in India, oral cancer in India, is one of the top 3 cancers encountered, and especially in men, but men and women are equally, the incidence is equal.
Right.
Coming to that, once we started, you get it, then you treat it, you have the patient do a biopsy, and then further treatment is done. But then we had this major, it sounds very common to all of us dentists, that what is the root cause of that cancer being caused? So that's why we started targeting tobacco. Like you need to uproot it from the basic things. So that's how I think ma'am also thought that she start her NGO and help the underprivileged, the people who are vulnerable, people who easily get access to this legal product, which is easily available, every 500 meters in India. So that's how she started with her group of friends in 2014. Then she started working with Yuvraj Singh Foundation also, I think in 2015. I joined in 2018. It's been only 1.5 years, but my experience has been amazing. I joined as a part-time volunteer and then went full-time. In between that, we also worked with Yuvraj Singh Foundation, where we were amazingly treated. We used to go for pan-India camps. We used to do so much of impactful work. I think ATTAC and Yuvraj Singh Foundation together were equally good volunteering experiences for me. Coming to why cancer also we chose, it's not like we want to treat them. We try as much as possible because there are out-of-pocket expenditures for most of the people who are trying to undergo this kind of an ordeal. The thing is, we wanted to start from the grassroots level and go up, where people have these myths that tobacco is like normal. Our ancestors also used to take it. What's wrong with it? Also, people are very afraid of the word cancer. Once they hear the word, first of all, they don't even want to come for screening. They don't want to come for screening also. So getting them to that point of the camp is equally hard. Once they get a screening done, and then you get something, there's a lesion there, or something susceptible to converting into a cancer, then that the entire journey starts. Like we have to actually ask them, request them, can you please get a biopsy done? So that journey, converting from denial to acceptance that you have a problem is what I think needs to be worked a lot in India, because cancer is nothing fearful. Once if you get into the early stages, you can easily treat it.
That's great, and thanks for sharing this inspirational, your inspiration and overall mission for the NGO. Now I'll go straight to the hospitality questions. As we know, we are going through a pandemic, COVID-19 across the globe, and right now the main concern from hospitality industry is what to do for as a next step, because hotels are opening up, consumers are about to come. Now, how can they get ready? Now, in that, so guideline also suggests to use masks, gloves, PPE kits to all employees of the hotels. Can these items be sanitized and reused later, or should it be just disposed after the first use?
The PPE, which says the protective personal equipment, consists of your eyewear, your masks, your gloves, and the gown. Mm-hmm. So the eyewear can be reused. Obviously, it's plastic. So you can either use 70% alcohol or just a normal sanitizer or alcohol swab if you get, and just clean it every time. You're putting it on, and if you're putting it back somewhere, it should be cleaned. Mm-hmm. So, but I would suggest not reusing any other thing. Masks and gloves and gowns cannot be reused. Mm-hmm. Especially, I understand, there's a dearth of supply. Mm-hmm. There's a demand is too high, but there's a dearth of supply. So I would suggest, choosing alternatives which can be recycled. Like you have a cloth mask. Mm-hmm. You have reusable gloves, especially for your dishwashing and all. You can reuse those gloves, and then you just need to sanitize them properly, and then you dry them. Mm-hmm. Gowns, I don't know how much the hospitality industry would want to use gowns because it kind of gives an alien feeling, and it's not actually required since you're not dealing with so much of aerosol like the doctors do, healthcare workers do, or even maybe the but I would suggest that using gowns for people who are sanitation workers, especially the housekeeping department, I would suggest they use gowns if available.
Absolutely. That sounds great, insightful, Anand, isn't it?
Yeah, just quite insightful indeed. And so my question to you is, people are asking about this disinfecting tunnel. And a lot of hoteliers were asking about this, that whether this disinfecting tunnel is really useful for disinfecting the luggage, and if people are going across that tunnel, so will it be really effective? So what is your take on that?
So according to, in India, the Ministry of Health and Family Welfare guidelines, they have advised against using disinfectant tunnels. It's not effective. Because you don't know where it's going, first of all, and on top of that, the most important thing is it's dangerous. These chemicals are corrosive, they're harmful, and you don't know what they're going to do in the coming years, because you expose them once, and then how does the body react? That happens over a period of time. So I would suggest going with the guidelines and not using these disinfectant tunnels, and maybe later on I can tell you, exactly how to go with disinfection once the Customer or the guest comes into your hotel.
Okay, that's really great. So so now a lot of clarity is we can see from you, and which is of course the misinformation, I would say, rather, which is there in the marketplace. And next part, people talk about HEPA filter also. Which actually reduces the bacteria and viruses from a particular area where it is fit. So do you really see that happening? Do you recommend for that?
So HEPA filters are effective. They're expensive, and the filters need to be changed I think every once in 9 years. But they're very effective because they increase the air circulation in the room. Like if you're in a closed room, and you have centralized AC, you don't have any air ventilation going out. So HEPA does it filters the air inside the room itself and then clears out the air. It's like basically a filter. So again, efficiency changes from manufacturer to manufacturer, size of the room, how many people are there exactly in the room. So I would again suggest use only FDA approved or EPA approved devices which have evidence, and HEPA has been being used in the healthcare industry for a very long time, so you will get a lot of devices. The demand is high, so maybe the cost would be high, so it's not necessary that you use it, but it would be, an added advantage that, there's air circulation in the room, and, you feel a little safe. But at the same time, the basic hygiene measures should not be ignored. There should be 6 feet distancing. There should be hand washing, hand sanitization. So HEPA is a good option because in healthcare, especially, we do use it a lot.
Right.
Wow.
Yes.
Wow. That's pretty insightful. Now, I will talk about some of the COVID-19 related preparedness questions, and in this question series, we will just go through different line items, and we'll ask your opinion on that. So, as a traveler starts, right, the journey, he has to, start by taxi in the airport, right? So let's start from that. What should be done in the taxi from the hygiene perspective, from COVID-19 preparedness perspective?
So before the patient, I'm sorry,
travelers. Yeah.
Before the travelers or the guests, I think I'd say the guests come to you, they have already started the journey from their, chief residence or place to where they're coming. And in a way, I think, the airplane and the airport journey is also, training them that they need to be a little precautious. So I would suggest, I'll just say for the car right now. So what you can do is, once the driver receives the guest, he can sanitize the car in front of them so that they know that, it's been done. Secondly, he can, every driver must be having, a face mask if possible, gloves if possible. Gloves can be any gloves, you get these reusable gloves also, you get these electrical gloves also, which, are very efficient. So any gloves, which doesn't have bare hands, I don't know, I feel bare hands is okay because I keep washing them, whenever I think I've contaminated them, I keep washing it. But I understand, it's outside, you don't have hand wash and soap, and there's sanitizer, there's not too much sanitizer. So when you come, first of all, do not overcrowd the taxis. At least maximum, I would say 1 person, but if they're from the same family, 2 persons are also allowed along with the driver. And if possible, if the driver has, now it's not this is idealistic, I'm saying, but if possible, thermal screening to be done. But then they're coming from the airport, or but they would be getting thermal screening done. So it's okay. Secondly, ACs are a no-no. Definitely, you cannot switch on the AC right now because it has been proven that AC in a closed area, it helps a lot of viral transmission. It circulates a lot. I think I forgot to mention about the luggage. The driver can put the luggage inside, or maybe they themselves can put the luggage inside, and then do hand sanitization, and then go in. Coming to all of them should be wearing masks. And each one of them in the it could be a cloth mask, it could be a 3-ply surgical mask, it could be an N95. I would suggest the driver keeping an extra set of masks in case they don't have it, but I think everybody is wearing a mask these days, so it's fine. Coming to anything, windows and all should be rolled down because it's hot also. They need circulation. If possible, if you want to keep one, you can keep a tissue box, in case anybody wants to sneeze or cough. But then they should also know that these tissues need to be discarded only in a dustbin as soon as possible and not being thrown here and there. Deboarding at the hotel can be done in the same way as boarding happens, and then after that, disinfection of the car once again. I'll tell you later on what exactly the disinfectants can be in the car and all. So I think that wherever you take precautions, and you're aware that I don't need to do this. If I'm coughing, I need to cough like this. If I feel I'm coughing a lot, I can step out of the car and cough. So that all things will come, gradually once the habit starts forming.
And in addition to that, so now the guest is going to the check-in reception place. Now, what things need to be done there in the reception?
So since I've been working a lot of I've been implementing a lot of camps, I create this SOP, where you need to follow each and everything which is written. And it doesn't matter if I'm doing it or one of my junior colleagues is doing it. you need to create an SOP that, and I think you should start even before the guest comes into you, in your vicinity. I would what I would suggest is you do a pre-call with the guest before he gets, on the plane also. Like 2-3 days before he's gonna come, you do a pre-call with him and you ask him a certain set of questions for your knowledge. I understand, these questions are getting repeated a lot, but then you also need to be aware. You need to also protect your employees and yourself and your hotel. So what I would suggest is you ask them, are they living in a containment zone? Is the zone which they're coming from a containment zone? They're not allowed to travel if they're living in a containment zone, because anything can change in 2 to 3 days. Next day, your neighbor has it. Next day, somebody in security has it.
Right.
So just ask, and this needs to be very frank. Like, you need to tell them that we're not trying to, perjure you. We're not trying to harm you. We just need the information, so everything can be, safe. We can create a safe community. And you don't need to be patronizing that aap kaise aa rahe ho, don't you know such. Just be very calm and composed with them. They might have an urgent family meeting or something emergency has happened. So you ask them that are you coming from a containment zone? Secondly, you ask them, have they traveled anywhere else within the last 4 days? Thirdly, you ask them, do they have the Arogya Setu app, because that is very important to travel. Fourthly, you ask them how old they are, that information you would be having, and are they having any comorbidities? Do they have any illnesses like diabetes, hypertension, and pregnancy, and people who have mobility issues? Do they need any extra help? Do they need, because some people who are aged, maybe you don't want to put them in a lift. You give them a ground floor room. So that's how you put them at ease that we also care about you. And I think this should be done with each and every patient. Just not the family of 4 is coming. You don't do it just with the father. You do it with the mother also. You do it with their uncle and aunt also. Each and every family member should know, and because it's important that it comes from their mouth. That information. You can also ask them, do they have any sore throat, runny nose, fever, high fever, cough, cold, weakness in joints, diarrhea, vomiting. These are all signs and symptoms of COVID. High fever, dry cough, and shortness of breath are the top 3 symptoms, which is initial symptoms. Now, it doesn't have to be that all these symptoms are, COVID only. It could be a flu, the change of season. It could be an allergy. So, somebody's asthmatic. It could be just a cough for them. So just take note of that, so that you can do extra disinfection for them, extra sterilization for them, extra ventilation for them. So you also know to be prepared, whether who's coming to my hotel, and any test has been taken for COVID or not. Like, have they been tested? Have they had it? Have there been a serum? Do they have their in a serum? The antibodies are there or not? This is what I would say. And Ministry of Health and Family Welfare has a lot of information, a lot of resources. Just download the PDF, where it says what do's and don'ts of how to airport travel, and you forward it to them, so that they also know. Maybe the airplane is doing it, maybe they're not doing it, but if you don't know, your guest is informed. So coming into check-in, like you said, so when they deboard from the car, what I would suggest is, if you wish, you can do disinfection of the footwear soles, like the soles of it. So you tell them to pick up their feet, and the soles are disinfected. Now, what disinfectant are you using? You're using 1% sodium hypochlorite, or you're using any phenolic disinfectant, be it Dettol, be it Lysol, mixed with water as per the manufacturer's recommendation. That can be done. The floors might get dirty, but they can always be cleaned. And if you have carpeted areas, I would frankly suggest either remove the carpet, because they are an additional source of viral transmission, or you do this. Secondly, their hands to be sanitized, and a thermal screening has to be done. Like, I would suggest, idealistically, for each and every person entering into your building, be it the guests, be it your employees. It has to be done. Secondly, you can have these sanitizer stations everywhere. It could be foot operated if possible. That's a way better option. Or it could be, just you put an elbow and you put it. Physical distancing of 6 feet is only done when there are markings on the floor. You can either use banisters, but banisters you have to extra sterilize it. Put circular marking, tape marking, so that people know where to stand. Put those feet wale stickers, people know where to stand. Coming to your reception desk, your check-in counter, I would suggest either the people wear a face shield. Now, this is a different thing. A face mask it just covers your nose and your mouth. A face shield covers your entire. It's like a plastic sheet, covers everything. Either they use that, or you can put up a plastic, like a barrier in between the desk and the guest. And also, if you can, QR codes for check-in, online check-in, that would be a great thing, because then that entire paper business and card cash business is gone. And if luggage has to be carried, it could be in a trolley, or the person who's carrying it should be like full PPE should be there, and the trolley can be disinfected later. And luggage sterilization, if you want, like it should be done with the UV thing if you want, if it is effective. Otherwise, you can ask people to get those plastic covering wale instead of cloth covering wale, so that the plastic coverings can be easily wiped down with 1% sodium hypochlorite or phenolic disinfectants also. So I think that covers your check-in thing till the patient, the guest enters.
Guest, yeah. And how about hotel rooms and housekeeping services as such?
So there's another SOP here. All your employees, everybody, starting from your gardener to your security guards to your housekeeping staff to your chefs to your managers, everybody needs to know what COVID is. I know it's there. It's there. I know everybody knows what, but they need to know the basics. If I have to do work, if I have to go and do work, and basically, how do I go through all this? So what the SOP would be a little training, like a 1 hour training with them for initial purposes, and a 20-minute get together with people, so that every day you kind of inculcate it into their habit. So you start off with their protection. You make them realize that first of all you have to protect yourself to protect others. So in case they are having any symptoms, any symptoms, now it could be runny throat because of runny nose because of maybe the AC was too high last night, but they need to take care because the guest doesn't know that. So the guest might think isko to COVID hai. So they need to take precautions. They can take a day off, or maybe they can have some tea and see how they feel. So they need to be very precautious, and they need to report those symptoms in case they have it to maybe somebody. So you can have maybe a hygiene officer or maybe the highest ranking person in the managerial team who can do all this. Secondly, whenever you're having gatherings, a meeting or a training, I would suggest do it in an open area with 6 feet distancing. Closed rooms have, obviously circulation is not great. Open areas are fine. 6 feet distancing, and it's been proven that open areas have less transmission rates than closed areas. Also, every wait staff, everybody has to know how to use a face mask and how to use the gloves. ऐसे नहीं है कि ऐसे हाथ लिया और लगा दिया. That's not how it's done. You need to clean your hands. You need to put the face mask, and you need to crunch it here. Like it should be adapted well to the face. In case you feel it's not adapting, use a surgical tape and paste it on your bridge of the nose. That's what I do. Because whenever it keeps on slipping, your hands will keep on going.
Yeah.
So how does COVID transmit is basically when your hands touch your eyes, nose, or your mouth. Why? Because these are all mucous membranes. These are all membranes which have no protection barrier at all, and they can easily transmit the virus to your bloodstream. Your skin is the most effective barrier in COVID. If you have a COVID particle here, it's not going to enter your body unless and until you touch it here. So they need to know that these things are important. They need to be very well versed in what the hand washing technique is. What are the steps? Do all the 9 steps of WHO. They need to follow, because if they don't follow, the guest will definitely not follow. Once they see what is being done, there's transparency in the system. That's what even I teach, like my implementation staff, that you need to do everything to the right thing, so that because anything can go wrong. Anything can go wrong. So your SOP needs to be strong. Your steps needs to be strong. This is here I wrote because I was making an SOP for my camp team also. Every morning thermal screening has to be done. Every morning, and you can make a checklist. This is the employee name. This is the temperature we noted. No symptoms reported. Okay, in the last 24 hours. Train and drill each and every staff in your COVID protocols. Be it anybody, everybody needs to, because you never know who's going to be absent the very next day, and they can take over easily. If employee had any symptoms, advise them to stay home. Hand washing and physical distancing are not substitute to masks and gloves. That's why I do not, I don't like the system of, gloves wearing everywhere outside except for healthcare, because it creates a false sense of security. You're like, glove pehen liya, to bas theek hai, ab kuch nahi hone wala, and then you go touch your face. That is not how it happens. Okay, so you need to know the basics. Ki ye 3 cheezein to karni hai. Face mask you're wearing, very good. Physical distancing and hand wash you have to do, and these are the basic structures on what we COVID we are fighting. Masks once they're fixed in your face, you do not touch them. And especially if you're wearing N95, get those tight fitting ones which adapt to your face well. And and I know it's hard. Wearing it is hard. It's hot. It's humid. You're not able to breathe properly. So whenever you feel you need a break, wash your hands. Take it off from the loop of the ear, only from there, not from here. Take it off, wash your face, take a breather, where nobody there, and then wear it back again. We understand, jobs are tough, and there's panic and there's anxiety, and it's okay to take a breather if you're doing it precaution. Gloves and masks and anything else which is a biomedical waste. So these are all biomedical waste. You're disposing it. Even the tissues of anybody coughing and sneezing and you think they have symptoms, they need to be disposed of in a yellow bag, a yellow biomedical waste bag. If you don't have a yellow bag, keep it in a separate bag, different from the waste the waste which is being produced by the what I would say is household waste, but hotel waste. And in case if you can, contact your local CMO, local authorities, local chief medical officers, local pollution control boards authorities, so that they can come and collect that waste and dispose it off as it is supposed to be, which I've learned, and I would say it's kind of my thing. Advise them to stop smoking and using smokeless tobacco. First of all, it's not a good thing. I have seen a lot of cancer cases. I've seen a lot of precancerous lesions, a lot of families being broken, socioeconomic, trauma because of, everything. We understand it's a stressful job, but try and, behavioral motivate them that smoking and spitting in, public should not be done. And if possible, please quit. Thirdly, then the last thing is, this is something which we have learned in healthcare. Get them a buddy. It's called a buddy system, where people take care of each other. There are 2 people. Isne mask nahi pehna hai dhang se, so you tell him. Now you're not scolding him. You're just telling him. So in case for example, there's a manager and there's a security guard. The manager has told the security guard ki you have to make sure there are only 5 people in the lobby. There cannot be more than 5 people. But once the manager comes on round and he sees there are 7 people in the lobby, he just goes up to the security guard and just asks them politely, how many people do you count? Like, how many people can you see right now? Don't you think, we should reduce? It's a team effort. We should reduce the number of people. So then both of them, can. So these are emotional, mental health things which also need to be taken care of. And as well as your health aspects also need to be taken care of. So I think that SOP needs to be done. coming back to your, there was a question. Did you have a question?
Yeah. And related to that, want to talk about the dining room, dining area, kitchen, or swimming pool, gym, or laundry service, right? I mean, what are those things which needs to be taken care of as such? From what SOP protocol should be there?
So for the dining areas and the restaurants, I think Ministry has given another set of guidelines,
Right.
in which they have said, do physical distancing. Now the thing is, we see a lot of images on the news. When people have these glass barriers in front of them, some tables are cordoned off, and there's 6 feet distancing everywhere. The point is, fine, they might work, but then again, there was this case in China where there was a restaurant and they had opened it up, and because of this air circulation, even though it had physical distancing and everything they were eating, right? So their face masks were off, so they had no barrier. From one, it actually shows, it's a very good case study. It actually shows that, from one area of the restaurant, how it goes to the other area of the restaurant. So I would suggest keep as much crowd minimal as possible, and use physical distancing and all. Use cutlery and all. If disposable, that would be better. And get those menus laminated. Get those menus laminated. The guidelines actually say something of a disposable menu. I did not understand what that was. But get those menus laminated. Whenever you're handing them to anybody or whenever you're getting it from anybody, use that spray and just wipe it down. So whenever you're wiping anything down, make sure it's in one way. Okay, you don't go back. You do this and you go back. That's not how it works. So make it sure it's one way. That's also there. And if you can, shift your dining area, if the weather permits, to outside. If you think it's a great day. Right now it's not possible. It's summer everywhere and it's monsoon everywhere. So if once these things happen, and it's just not for now. These pandemics might just keep on happening. So maybe for later also.
Yeah, and how about swimming pool, or let's say gym or laundry service as such, or elevators as such?
Okay, so all of these things, yeah, I'll go one by one. So the pools, frankly, I would suggest not to open them, even though CDC in the USA says you can open them, and they've given such guidelines on their website. But the problem is, the India cases are rising up daily. The graph is going steep. So I don't think we should ape everything the US does or any other country does. Your SOP for COVID should be sticking to India, or maybe whoever is listening, to your country. You should understand, get advice from healthcare professionals, get advice from public health specialists, so that they can help you out as to do what. I would suggest pools no for now, because there's a lot of there will be crowding and there will be transmission. COVID also has an orophycal route, so I don't want to get into that. But mostly, there's no barrier there. You can't swim with a mask. You need to breathe.
Right.
So just not for now, especially not when these cases are so high. And you never know where we'll go with these cases. There's no healthcare system, to support that. You're already broken. You can't fix the healthcare system during a pandemic. So we don't want to overburden that. Coming to your laundry services, anything which has to be washed should be in bleach-based detergents. It should be bleach-based. And if you possible, please remove your carpets. Curtains, I know, but if they can be replaced, please use a plastic curtain, or maybe the blacked out windows, because all of these are fomite transmissions. There's carpet, there's towels, there's curtains. All of these kind of increase fomite transmission. The particle stays there, and once you shake it, the particles just go into the air. So whenever you're collecting laundry, or whoever's collecting laundry from the hotel rooms, first make sure they have PPE, they have gowns also, because it's a thing. Don't shake the laundry. Do not shake the laundry. Go and directly deposit it in the bleach-based detergents, where you can soak it for a while and then give it for washing, and dry it properly. Because if you don't dry it, the bacterial and the viral replicates very fast. So just dry it properly. If a dryer is possible or sunlight is okay. And then whoever's ironing, again, face masks or these are face shields if possible, and gloves. And these gloves can be those electrical gloves I was talking about. They are they're heat resistant also. So you can just do that. I think laundry is done, swimming pool is done. Gyms have a high risk of transmission due to vigorous exercise, and the droplets go far when you're exercising. If you do want to open a gym, well enough, crowding should not be there. Every machine should be sterilized before and after a person has used it. Why before? Because when people are walking by, when they're breathing too hard, the droplets go far. And science has seen that droplets go far as maybe 20 meters. Because right now they're going 1 to 2 meters. That's why that's 6 feet gap. But when you're exercising and there's too much, you're breathing too fast and you're inhaling, exhaling too fast, they can go very far. So kind of just wipe that down, well ventilated if possible, and there should be hand sanitizer stations everywhere where people can access it, and if possible, get booking
help. And while we are about to wrap up the call, let me ask about the centralized air condition, right? There is a certain thing, like they mentioned that the temperature should be 24 to 30 degree, or humidity should be 40 to 70%, right?
Yeah.
What do you think, about it?
Now, the thing is, hotels have centralized AC, so that ventilation is kind of closed off. So they did some studies where they saw how much temperature matters, ambient temperature matters on COVID particles, and how much humidity matters on COVID particles. So they came to know that anything less, like 20 degrees is what you think is good, but in case it's 20 degrees, it's easier for the viral particles to there's a prolonged survival on the contaminated surface. That's when you say you have the flu season. That's because the particles are there. They're generally during 20 degrees, the cold season. That's because the viral particles are there and they're not easily killed off. The ambient temperature 20 degrees, this is legit from the study. It says can survive for 2 days while losing only some part of its infectivity. So that's why they've said 24 to 30. Coming to relative humidity, so when it's at this humidity, which they have said, something happens to the viral particles. Now the COVID particle is an enclosed particle. It's an enveloped particle. So in relative humidity, which they have, I think 40 to 70%, it desiccates. Like the particle kind of just bursts open, and once it desiccates, it's no longer an active particle. At a low relative humidity, that desiccation, that oxidation, or those reactions basically do not happen. And even at a higher humidity, once you cross around 80%, that desiccation, which is basically the water interface with the particle, that does not burst open. So I think they've done a lot of tests, and that's why they've come up with these guidelines as to what the ambient temperature and the relative humidity is. Apart from that, they had also mentioned another thing, that in case you have a centralized AC, switch on your AC 2 hours before your start of operations, and switch it off 2 hours later your start of operations, so that circulates very well.
Right.
Everything. Secondly, I would suggest whenever you can, open the windows for a period of time, so that if you have fans and coolers, even better, switch them on, direct them to an open window, so that the air circulation keeps on happening. I think I missed out on elevators. Maximum one person. If the lift size is too big, 2 person. There are some US hotels which are also saying 4 persons, facing all the walls of the elevator. But I think 2 is enough. 2 should be fine, like 1 liftman and 1 other person. If there's no liftman, 2 from the same family member. And same process, touching the buttons with your elbows. And since there is no centralized AC there, if you can put a fan there, that would be great. And I think, that's that. There are some antibacterial films you get. It's been used in South Korea, where they put it on the button so that whenever people are touching it, your hand gets sanitized. If you get it well enough, otherwise it's okay. Just put a sanitizer station in the elevator.
Mm-hmm. Great. So that's quite a bit of information, and thank you for sharing those information. While we are about to wrap up our call, Dr. Dikha, is there any other point you want to add in our conversation today?
I would just like to wrap up saying that I have a lot of experience now. I wouldn't say a lot, but the experience that I've faced with working with people on the field and people who have health conditions, deteriorating health conditions and cancer, it's pretty similar to what we are facing in COVID. Because like I told you before, people don't want to come for screening because they don't want to know that they have a disease or not. Because once they know they have the disease, uske baad ka kya? What do I do after? I can't afford to get that knowledge, and that's why they are fearing the word cancer. It's the same with corona. Like, if I get it, if I venture outside, I get it, and what happens to my family? What happens there? So that fear of not knowing what the disease is in the first place, because it keeps on changing every day. It's a progressive disease. It keeps on rapidly evolving, and I wouldn't say there's no mutation as such, but it might, because whenever it replicates in your body, it might just take another piece of DNA and then mutates. So I would suggest keep your SOP strong, keep your, prevention, protection, and progress. That's what I wanted to say. 3 P's, where you prevent, you protect, not just yourself. And whatever you teach your employees, tell them to go, train their families also, so that everybody knows. Like, it's a big community thing. That's how community works.
Right.
So you protect and you prevent, and then you progress your SOPs. Get feedback from your employees. Get feedback from your guests. What do you think you're doing wrong? Get a health official to come see what's going on, if they can suggest anything. So keep on progressing that SOP. And I also wanted to mention the 3 C's, which is care, compassion, and comfort, because I think that's what works in your hospitality industry. Keep taking care of people, being compassionate, making sure they're comfortable. At the same time, keeping the guidelines in your head. And also, I wanted to say the 4 S's. I actually came up with 3, but then I realized one more is there. Safety, sanitize, and standards. These are the 3 I came up with. Where you are safe, you sanitize everything because the times of corona, and you have standards. You cannot, कि अगर हाथ धोना है, तो I have to do that 9 steps. It should be for 20 seconds, and the tap should be off because water problems are also there. Try not to mix water into soap bottles or those sanitizer bottles. Efficiency goes for a toss. Try not to reuse your PPEs. ऐसा नहीं करना है कि put it in some kind of wash it off, and that efficiency, that filter porosity is gone. It's just a psychological barrier.
Right.
And then I realized that this is the hospitality industry, so I wanted to add one more S. So with safety, sanitization, and standards, I wanted to add service. You are here to serve the people. Healthcare and hospitality both work as demand, or the demand is high, so we work for you.
Right.
So you are serving the people, but for the first thing, you need to be safe, so then you can keep other people safe. Any other things, keep on updating yourself. Keep going to the ministry website. There's so much of resources. Go to the trusted sources. If you feel, just go talk to a person. Go talk to a doctor. They're willing to help you. They know how uncertain these times is. They will go through the evidence. They'll go through the research papers. I understand those are all very logical terms, very scientific terms. We'll break it down for you. Population density ज़्यादा होती है, so there is more chances of transmission. So just get help, get feedback, and just be safe, sanitize yourself, keep those standards up, and provide service to people. That's how I wanted to end.
Absolutely, and that's a great insight, Dr. Dikha. It was wonderful talking to you. And while you stay on, we have some follow-up conversation with you. But thanks for being in the show, and it's such a pleasure to have you here. Thank you very much.
Thank you. I hope this helps.
This will surely help. It has a lot of information. This will surely help. Thank you very much.